Hey everybody, it's Jason Russell, student physical therapist assistant at Jefferson State. Today I'm going to be talking about COVID-19 versus SARS. So we have the coronavirus. So SARS stands for Severe Acute Respiratory Syndrome. When I started researching this, I found an article from a hospital in Hong Kong that looked at the data from 111 of their staff who were in contact with a patient or multiple patients with SARS. Their definition of in contact was within 3 feet of the patient. At the end of all the research and the conclusions that the article came up with, they found that the surgical masks and the N95 respiratory masks worked 100% of the time in keeping the hospital staff infection-free from SARS and the patients that could infect them. Now, on the contrary, the staff that used paper masks, there was a small percentage of them that did become infected who were still using all the same universal precautions as the other staff that used the same universal precautions, but instead used a surgical or N95 respiratory mask. It was also found in the study that all the staff that were non-infected with SARS at the end of all the research found that the surgical mask, N95 mask, and hand washing were the top 3 things that could be done to prevent the spread of infection of SARS. So what is SARS? As I mentioned earlier, SARS is Severe Acute Respiratory Syndrome. The first case was in 2003, the last case in 2004, found in scientists in a controlled lab situation. The name given to the virus was SARS-capital C, lowercase o, capital V, and you'll see why that's important later. And then one of the other biggest things that I kind of took away with this, with the research that I did, was the way that governments handled controlling and containing the spread was through early detection of the disease with patients, isolation of those patients, and also to see who had come in contact with the infected patient and to test them to decrease the spread and to encourage social distancing. So what is coronavirus? Coronavirus is actually a very diverse family of viruses. It's primarily found in bats. A lot of people were confused when they learned that on if it's found in bats, how is it affecting us right now? And that's because, as we know, viruses can mutate and basically transform into different forms of themselves. So there was a new development or new mutation of the coronavirus that allowed the transmission of the disease or the virus from bats to humans. And whether there was a carrier involved, which has kind of been talked about and speculated, but not really factually proven at this point. But when this happens, where a disease or virus is spread from an animal to a human, is called zoonotic transmission. And so this virus, coronavirus, or as we know it, COVID-19, is so contagious and severe because humans have not been able to be exposed to this virus up until this point, since it is primarily found in bats, and since this is one of the few first strains that have been able to be passed from animal to human. And our bodies have not been allowed to create antibodies, which, as we've learned, are the body's first line of defense in the immune system to combat the invading virus. So SARS and COVID-19 are actually very similar, as I learned. COVID-19 and SARS are both caused by some form of the coronavirus. So to call what's happening coronavirus is technically inaccurate. It is a form of the coronavirus, but more specifically, it is COVID-19, because SARS is also a form of coronavirus. COVID-19 was caused by SARS capital C lowercase o capital V 2. So COVID-19 is almost a secondary or an aftermath of SARS, a mutation, if you will, from the original. It is a little bit different and a little bit of the same. There's still research going on about is it more like SARS? Is it more like coronavirus? And I think only time is going to really tell between those two answers. So one difference between COVID-19 and SARS is the way it spread. SARS had fewer cases, but more cases were more severe. 20 to 30% of patients who contracted SARS had to have mechanical ventilation, whereas only 10%, roughly, patients who contract COVID-19 will require mechanical ventilation. Both, of course, will have respiratory distress and disorders that comes with the disease. And another difference is the contagiousness of it and how it's spreading and the speed that it is spreading. With SARS, it was more found in more closely packed communities and definitely in nosocomial situations in hospitals, whereas COVID-19 is spreading in any environment really where there is contact between person to person in different forms. It's spread through talking, sneezing, coughing. So COVID-19 has spread much more quickly, mainly because actually a lot of the patients who are contracting COVID-19 are either asymptomatic, which means they are having no symptoms at all, meaning they do not know that they have it, and they are not isolating themselves or self-quarantining to prevent the spread, or they are pre-symptomatic, meaning while the virus is in the incubation period or just waiting and can still be spread, the patient or person doesn't know they have it, and they will resume regular activities, being in contact with other people, being within 3 or 6 feet from people, and potentially spreading the disease. Another is when it first spread in the original outbreak, there was not a lot of information about the disease, of course originating in China, and there's a lot of politics behind it that don't need to be gotten into, between communication between countries, communication between government and World Health Organizations, and with patients being asymptomatic and pre-symptomatic, this not knowing that they are a carrier of the disease is a large contributor to them going out into public, going out into communities, socializing with other groups, and potentially spreading the disease. And of course, this is a chain reaction. 1 leads to 2, 2 to 4, and so on. The CDC is now saying, as of today, that any form of paper mask is recommended to slow the disease. At the beginning, they were advising people not to go out and buy or use masks because they were not, the people that were buying and trying to hoard and price gouge and so forth. The country needed it for our health professionals and essential people to use, first responders and so forth. Now the CDC is recommending anyone who can create or use a paper mask to do so. The CDC has given recommendations on what to use. Famous researchers and doctors and stuff, such as Dr. Oz, have recommended various different forms or creations, such as bandanas, to slow, not necessarily stop completely the spread. of the COVID-19, but these are things that are changing daily, hourly, so forth, that I could say something right now and then tomorrow morning it could change. So that's all I got for you right now. Thank you guys so much for listening. I hope you learned a little bit between SARS, COVID-19, where we stand now on respiratory masks. I want you all to be safe. Stay 6 feet away from other people. Stay in touch with your loved ones, see how they're doing, and everybody stay safe.